Okay, there we go. Good morning, UBC Okanagan, and good morning to all of you who are online. Hello, Marie.
Good morning, Naz.
I am going to start. For those of you who weren't here yesterday, my name is Naz Virji-Babul. I'm the Director of Research at UBC Health. I will be co-hosting this event today with Dr. Marie Tarrant, who will be joining, is online from UBC Okanagan. I'd like to just make a few introductory remarks about Marie. Dr. Marie Tarrant is the Dean of the Faculty of Health and Social Development and a professor in the School of Nursing. Dr. Tarrant's research is in maternal and child health with a focus on breastfeeding, the Baby-Friendly Hospital Initiative, and maternal and childhood vaccinations. Study methodologies include large longitudinal cohort studies, population-based cross-sectional studies, and randomized controlled trials. The goal of Dr. Tarrant's research is to improve maternal and child health outcomes, inform public health policies, and transform perinatal healthcare services. Dr. Tarrant is a lead investigator at the UBC Okanagan School of Nursing, Maternal and Child Health Lab, and is a frequently cited UBC expert on maternal and child health, breastfeeding, vaccination in pregnancy, and childhood vaccinations. Dr. Tarrant was previously the director of the School of Nursing at UBC Okanagan from 2016 to 2021. And prior to coming to UBC, she was a professor and deputy head of the School of Nursing at the University of Hong Kong. Please give a warm welcome to Dr. Marie Tarrant. Marie, over to you.
Thank you, Naz. I have the pleasure of introducing Dr. Nazanin Virji-Babul, and known as Naz to us. Naz is a physical therapist, neuroscientist, and associate professor in the Department of Physical Therapy at UBC's Faculty of Medicine. As the Director of Interdisciplinary Research at UBC Health, she leads efforts to advance interdisciplinary health research collaborations, supports implementation science, and contributes to building a learning health system. Dr. Virji-Babul works closely with researchers, university units, and health and community partners to address complex societal health challenges using a holistic approach. She is deeply committed to fostering equitable relationships, embracing diverse perspectives, and promoting innovative collaboration practices across UBC's Vancouver and Okanagan campuses. Previously, Dr. Virji-Babul served as the senior advisor to the provost on women and gender diverse faculty, where she spearheaded initiatives such as a leadership program for women and gender diverse faculty, a faculty survey on the impact of COVID-19, and a toolkit for increasing diversity among keynote speakers at scientific conferences. She also created an outdoor art project to celebrate and amplify the contributions of women and gender diverse faculty and staff at UBC and in the broader community. So please join me in welcoming Dr. Nazanin Virji-Babul.
Thank you.
And back to you, Naz.
This back and forth is working great, Marie. Okay. We have another full and exciting day of plenary sessions and concurrent sessions to continue our dialogue from yesterday. Yesterday, I know that I heard lots of really meaningful conversations that were grounded in Indigenous ways of knowing and cross-sector perspectives. It was really exciting to be here, and I'm sure today will be just as great. The focus for today is that we're shifting our lens to the systems and structures that enable innovation and implementation. We will hear from funders, policy leaders, and institutional partners and explore how to sustain and scale innovations that advance health equity and improved outcomes. Now, before we start, I have some absolutely wonderful news to share. The night before this two-day event, the UBC Senate approved the establishment of a Center for Innovation in Collaborative Health Education and Team-Based Care. This center is a result of a multi-year collaborative process that was facilitated by UBC Health in partnership with health professional programs at UBC. This includes dietitians, family physicians, family practice nurses, kinesiologists, midwives, nurse practitioners, occupational therapists, pharmacists, physical therapists, and social work. This is a huge deal in the simplest way I could say it. The center will be a provincial resource and a space for the Gateway Clinic on the UBC Vancouver campus and a broader network of existing and potential team-based care teaching clinics throughout BC to generate and mobilize knowledge and scale models of collaborative health education and team-based care. As you can imagine, all of us at UBC Health are extremely excited that this initiative has been improved. We can hardly wait to get started. And if you see anybody in the UBC Health team today, please feel free to congratulate and hug them because this is really a big deal. So, congratulations to the whole team. I will turn it back to you, Marie, to make your opening comments and introduce the panel.
Thank you. Thank you, Naz, and thank you for sharing that wonderful news. That's wonderful to start our second day of our workshop. So I just want to highlight that this morning's plenary session will share insights from funders on supporting innovation across different health sectors. There will be interactive sessions throughout the day, and we will end with a keynote from Dr. Tara Kieran, who will offer a forward-looking perspective on community-driven systems transformation. So before we start, I just have a few reminders. Please use Slido to submit questions, reflections, ideas, comments, any feedback that you have on yesterday or today's conversations, and anything that you both online and in person, and to continue the momentum from yesterday. And before we get started, I just have a few key housekeeping items. So just a few reminders, the plenary sessions and the ones in the main event room will be recorded and they will be available on UBC Health's YouTube channel. So they'll be open to anyone. So you can also feel free to share those with your colleagues and people who are not able to attend the event. You can use Slido again to submit questions, comments, or feedback. It's on the screen. It was on the screen. It was also on the table yesterday. Is it still on the table? The little QR? Some of them, yes. So and give us feedback on the event. Accessible washrooms are available at both venues. Please follow the signage or ask the event team for the directions. They are sitting at the desk or they're also wearing a badge, which identifies them as being with the event. Online participants can contact team members through Zoom, and they are labeled as event organizers. Excuse me. Lastly, we thank you in advance and during the day for your continued patience with any brief technical interruptions as we navigate the hybrid site format. Okay, so for our first session this morning, it is my pleasure to introduce our opening plenary speaker for the second day of Bridging Action and Research Symposium, Dr. Deanne Taylor from Interior Health. Many of you in this room are familiar with Dee. Dr. Taylor is the corporate director, of research for Interior Health, co-scientific director of the Rural Coordination Center of BC, senior research advisor for the Canadian Health Leadership Network, and an adjunct professor here at UBCO in my faculty, the Faculty of Health and Social Development. She leads research, innovation, and learning health system activities with a focus on integrating evidence into practice and decision-making. Dr. Taylor is a strong advocate for advancing evidence-informed practices and promoting learning health systems at local, provincial, and national level. With a background that includes a baccalaureate in athletic therapy, a master's in disability and community studies, and a PhD in community health science. Dr. Taylor also completed a postdoctoral fellowship at the Center for Aging, Mount St. Vincent University, and a fellowship in health systems transformation at the University of Alberta. She provides strategic leadership on numerous projects in research, innovation, and health systems. Dr. Taylor regularly presents at scientific, professional, and community forums on topics such as learning health systems, health system transformation, and public-private partnerships in healthcare. Her work aims to improve healthcare practices and policies by fostering collaboration and evidence-based solutions at multiple events. So in today's opening plenary, Dr. Taylor will speak to us on funders of health innovation. So please join me in welcoming Dr. Deanne Taylor.
Thank you, Marie. I really appreciate that. Just checking audio so everybody in the room and online can hear. If someone can just give me a thumbs up. Thanks, Marie. Thank you for that introduction. Just want to add a couple of notes of thanks and gratitude to Elders Rose and Kathy, and to Derek, who I understand provided the opening remarks. Just want to say thank you very much. Really feeling grateful to be an uninvited guest here in Kelowna on Silk's territory. Apologies to you in the room. The panel and I had a conversation just in terms of format, and we just thought this would be, the virtual piece would just be a better offering for you and all of the participants if we are online. But just back to my gratitude to Elders Rose, Kathy, and to Derek. You heard my opening in terms of the what I'll call the human doing. Also want to say, as a human being, I am a mother and a daughter and an aunt and a wife, a friend. And just I'm really grateful to be here with you all today. And I too try my best to honor the truth and reconciliation in my day-to-day. And I'm just really grateful that we're here. It is an honor to be with all of you, and just really appreciating the land that we get to be on here in this beautiful province as well. So just grateful to all of you. What an exciting couple of days. This is such an important topic. I think it is timely. The bridging research into action is something that has spoken to my heart for many, many years, and that includes all of the spectrums on it. And funding is a big part of that. There is such a role in funding to help support that bridging. And I'll use also innovation, that research and innovation and the evidence into practice into the health system. So I think this is an important conversation. I'm privileged to be part of an excellent panel group today. And basically, we're going to kick this off with our first speaker. I am going to go essentially, just so that everybody knows, I'm going to let each speaker introduce themselves, and we have a couple of key questions that I'll post in the chat. So we're going to start off with Danielle, and there's an overarching question that I'm giving to all of the panelists. So I have had the privilege to work with all of these amazing panelists, and certainly Danielle is one of the ones that I've known for quite some time. Really glad, Danielle, that you're here. Hoping that you can just give a quick intro to your role. And the overarching first question that we're going to ask is, why is this topic important to a funder? Why would this be something that a funder, that bridging action be something that a funder would be curious about? So I'll take that and post that in the chat, but over to you, Danielle, just to sort of kick us off, introduce yourself, and start with that first question. And then I have a second follow-up question for you.
Great. Thanks, Dee. And good morning, everyone. I'm Danielle Lavalee. I'm the Vice President for Research Programs at Michael Smith Health Research BC. I'm pleased to be joining you today from our offices, which are on the unceded and traditional territories of the Musqueam, Tsleil-Waututh, and Squamish Nation. For those of you who might not know, Health Research BC is a provincial agency, health research agency that funds people and health research with a strong focus on partnership, on shared opportunities. We are funded by our provincial government, and as stewards of public funds, we're committed to supporting BC's research talent and supporting and strengthening the environments in which they work. And I think, Dee, that speaks to the first question of why this topic is so important, that as stewards of public funds, our hope is that the research that's funded, the talent that we support are in fact developing evidence that is applied into healthcare to make outcomes better for patients and the folks that serve them. So I'm really grateful to be part of this conversation today and look forward to hearing from the other panelists, because I think funders have an important role in making sure that research does actually find its way into action.
Thank you, Danielle. Couldn't agree more. And back to Danielle, just for the back to you again, just to kind of keep us going. There continues to be a gap between research generation and its use. What role do you see for health research funders to address this issue?
Yeah, so thanks for that question. I think for Health Research BC, this particular topic has been part of our long-term story in terms of knowledge translation and thinking about how we build capacity for research to be moved into practice. We've recently refreshed our strategy for the organization, so it's also top of mind in terms of how we think about how we support talent through our funding programs, how we partner with others on shared research priorities, and how we're evolving our approaches to funding. With respect to that last one, which I think speaks really well to this particular topic, over the last year and a little bit, we've been developing a new funding initiative that really targets this issue head on with respect to seniors' home and community care. So I'm excited for this initiative for a couple of reasons. First, it aligns funding to address the priorities that we're facing in this context, aging. It isn't about generating new evidence too. It recognizes that there's actually a lot of really great evidence around how we can improve seniors aging in place. We just need to get it into practice. And so the way the funding mechanism has actually been developed is with that in mind. How do you create good funding practices to support evidence getting into practice? So the first step in this process is really developing a funding mechanism that allows teams to come together and make sure that the questions that are being asked, the innovations that are being put into practice really are responsive to the environment in which the work is happening, that different decision makers, patients, health authority leaders, researchers, clinicians have the ability to inform how that project comes about, and then ultimately we'll find ways to fund that. So I think it's a really great example of not only thinking about what needs to be funding, but how can we adapt as funders to make sure that the work can move forward. And then the last point I'll say on this is, as an organization, we work nationally, internationally on creating and using evidence on how to be an effective funder. So we're working to really look at different ways people are approaching their funding practices and trying to apply that into the work that we do. So in fact, being evidence informed in our work as a funder and how we continue to learn with others in that practice. So so I'll pass it back to you, Dee.
Wonderful, Danielle, such a great response, and excited to kind of dig into that a little bit later once the other panelists have had their chance. So we're going to move to the foundation group next, just a heads up. And Angela, really, really happy that you're here joining us today from Vancouver. I'm wondering if you could just provide a brief intro for yourself and the lens you carry, and address that first question again. Why is this topic important to a funder from your perspective?
Wonderful. Thank you for that, Dee. Yes, I'm Angela Chapman. I'm the president and CEO of the VGH and UBC Hospital Foundation. And we're the leading charity investing in healthcare innovation in BC. We partner with Vancouver Coastal Health, and because VGH is the largest teaching hospital, Vancouver Coastal Health Research Institute is the leading research institute in terms of funding in medical research west of Hamilton. Those are kind of our credentials to state that we're the leading charity investing in healthcare, along with the fact that we raised $130 million last year and granted over $60 million to our beneficiaries. So we fund a wide array of projects, from capital to people to programs across Vancouver Coastal Health. And research, of course. Our model for funding is a little bit different than, say, what you heard about Michael Smith Foundation. We are more of a matchmaker because we work with many donors. Our work really is in that engagement with the community and bringing those donors to match up with priorities across Vancouver Coastal Health, and looking for those innovative partners who have interesting ideas about changing the system. And to craft those into something that we can take to a donor market and raise funds for those. So it's a little bit different. And I would say that in terms of what appeals to me or what is important to me about this question is really, it's that our community of innovators, one, knows about us, knows that the way that we work. And I would say, just in terms of creating that innovation in the system, one of the things that we've experienced is funding many great ideas that demonstrate their value within a direct partner like VGH. And then sometimes being a little bit disappointed or frustrated or just wondering why they haven't been rolled out across the entire system. So that gap is something that we experience as a funder, and why this is so important.
And you've leaned in on that next question, just about what is important to understand about a project or overall. I don't know if you want to add any other comments about the matchmaking process itself.
Sure. I mean, we are actively engaged with our community of innovators, but we're always looking for new and fresh ideas that are going to improve the system. What's important to us is to know the metrics by which they're going to judge that they've changed the system and improved the system. So being prepared with that information coming to us, I think, is really important. And I would say that we're open to fresh new ideas and individuals with great ideas to come to us. Ultimately, we need to put them in a form that is a marketing campaign, get them out and give our teams sufficient information and those metrics that they can convince donors that this is something worthwhile investing in.
Such important comments, Angela. Thank you so much. So you've given us the chance to sort of look at that individual, and we are going to move now next to Mike, who I think has a really interesting perspective as well. If you can just introduce yourself, Mike, speak to that overarching question, and then I do have a second follow-up question for you. So over to you, Mike.
Thanks, Dee. Hi, everyone. I'm Mike, Acting Director of Strategic Granting at Vancouver Foundation. And so we're a community foundation that supports nonprofits and charities across BC to build healthy, vibrant, and livable communities. So I'm bringing a community funder lens to the conversation. We might not be your typical research funder, but if you are co-leading research with community, we might be an option. While research grants that we offer are relatively a small part of our overall funding, we think they play a powerful role in elevating the leadership of communities that are experiencing some of the greatest health inequities. Our participatory action research grants complement what's available from other funders. We support partnerships with community researchers and academic researchers and health systems researchers to investigate health-related research questions that are coming from community and to generate knowledge that supports action at the community level. We offer a short-term convene grant that helps teams co-develop research questions and develop a project plan. And we also offer a longer-term investigate grant of up to 3 years to support research implementation, analysis, and community-informed knowledge sharing. So we're really hoping that findings from our projects can inform policy and ultimately contribute to systems change in some fashion. We're looking to support and prioritize flexibility and relationship building and shared leadership in the grants that we're making. And just if you'll allow me a quick plug, our next application window opens in early July. And as to the question of why bridging that gap between research and action is important to us. It really ultimately comes down to better outcomes, health outcomes for community, and that's really at the core of all of our funding. Is to support community that's most impacted by systems of oppression, and to take to leverage their talent and expertise and leadership in advancing solutions to those problems.
Such a great answer, Mike. And we're going to bring Mike back on just so you know, because I have a follow-up question. So what lessons can we take from community-based participatory research funding about moving research into action? Now, you touched on that a little bit. Anything else you could dig into in your opening comments here?
Yeah, I think there's some opportunities to take lessons from it, and for some approaches that funders can take around supporting this type of research as well. And so one of those key lessons, I think, is that the action doesn't necessarily have to wait till the end of the project or to the final report. When communities are co-leading that research, they're often already advocating and organizing and experimenting with solutions as that unfolds. And so it sort of makes the participatory research process a form of action in itself. As funders, I think this challenges us to support not just that research rigor and process, but also some responsiveness. So this can mean funding things like community gatherings to reflect on early findings, translating results into culturally relevant formats or languages, offering opportunities for some flexible follow-up funding as well, or additional grants in a continuum that can support moving to the next stage of a research process or into an action process. I think the proximity of lived experience to this kind of work also kind of helps close that gap between learning and doing. So there's an opportunity to partner with community in a way that can really support not just the research, but those pieces around it that help influence the receptivity of the system to those changes that you're making as well. So I think we do need to pay attention to that system readiness piece, understand where there's openness to change and where and early on where there might be resistance encountered to an innovation. One way we can support this is to encourage research teams to identify allies within the systems, anticipate obstacles, and think strategically about how and where findings can be taken up within the system. Yeah.
I just want to underline, so we hear often that partnership is so incredibly important at the beginning, which helps that bridge and the impact. And so I heard all of that in what you said in your comments, Mike, and looking forward to sort of digging into your comments a little bit later. So as we move through our foundation group, we've had sort of that higher individual, we've got sort of community, and Melina, with the Kelowna General Hospital Foundation, I know that this is important to all of the foundations here and many hospital foundations. So really excited to hear your comments, just in terms of, if you wouldn't mind just doing a quick intro again, taking a stab at that overarching question about why is this important to you from your perspective, and then I have a follow-up question for you. So over to you, Melina.
Thanks, Dee, and good morning, everybody. My name is Melina Moran, and I am the Director of Partnerships and Grants with the KGH Foundation. I am an uninvited guest on the South Okanagan territory. The purpose of the KGH Foundation is to facilitate the partnerships needed to enable excellence in healthcare at Kelowna General Hospital and in healthcare settings within the community. Through the mobilization of people and resources, we catalyze the changes needed where it matters most, right here where we live. We aim to become the eyes, ears, and voice of the community, actively listening to and advocating for the people we serve. Our lens is people, place, and innovation. We invest in and nurture innovation within regional healthcare by fostering novel partnerships and championing upstream creative solutions to the challenges we face. the newly established Jim Pattison Center for Health Systems Learning and Innovation will serve as an incubator for pioneering healthcare solutions and facilitate their development and integration into the community. So why is this topic important to funders? We know there are many solutions-oriented clinicians who have the passion and desire to see systems change, but don't often have the network or funding support to actualize those plans. There are often solutions that have been identified in other regions or countries that are applicable to us, but might require a lit review or KT planning or facilitation time to implement. The KGH Foundation wants to be that partner in the Central Okanagan.
Great response, and agreed. It's so important. It is really heartening to see how funders are really seeing their role in that bridge. And you spoke to a lot of the initiatives that are certainly high on KGH Foundation's list to get behind that. Now back to you, Melina. Just curious if you can speak a little bit more about the opportunity and gaps that you see in funding innovation in healthcare solutions. You touched on it. Anything else you want to just unpack in your response there?
Sure, thanks, Dee. So in the past, we were typically asked to fund equipment needs, but over the last 4 to 5 years, we've really seen a shift in the types of requests that include other tangible costs. So sometimes the piece of equipment is plug and play, and there are no other budgetary elements to consider. But in some cases, there's also consumables, specialty training, research activities, software, and protected physician time to possibly research the best technology or treatment and actually facilitate the project. So our focus is to never duplicate or replace existing funding. And although our physician partners and medical leaders might have access to other pockets of funding or streams, the projects don't always meet the eligibility criteria of those streams. This is what we kind of call the opportunity gap, where the puzzle pieces just don't fit. So in order to support innovative project ideas that focus on improving the patient experience and or service delivery, we had to get creative and change some operational processes in order to find ways to compensate these health professionals for their time, therefore advancing on our guiding principle to bring world-class healthcare to KGH and the Central Okanagan. So since we have the flexibility to create our own puzzle pieces, we're able to advance on projects like this.
Perfect. That's such a great answer. Really excited. Thank you very much. So you can see really how the foundations, Health Research BC, we've heard from at the beginning, and the foundation perspective. And so we're going to shift to a national perspective. I'm so grateful, Jennifer, that you were able to join us from way out east, hoping that you can share with our audience just your brief intro, your perspective, and your thoughts on just the overarching question about why this is an important topic. So over to you, Jennifer.
Thank you so much, and thanks for inviting me to be here. I'm joining today from traditional unceded Algonquin territory near where the Ottawa and the Rideau Rivers meet on a beautiful spring day, so hopefully you're having the same luxury where you are. My day job is as CEO of Healthcare Excellence Canada, and if you think of a bridge having two ends to the span, we start from the action and move backwards. Our focus is to shape a future where everyone in Canada has safe and high quality healthcare. And that includes identifying people who are working on wicked problems and connecting them with each other, surfacing proven innovations that then we focus on spreading and scaling, recognizing that we can't just work innovation by innovation. We also need to build capability and capacity in the health system for change, whether that's leadership or how to engage and partner well. And last but not least, local teams can do amazing work, but if they're trying to do that work in a policy or a structural context that makes it hard, they're pushing water uphill. So we also look at how can we catalyze policy change that makes the right thing to do easier. And so when I think about your question, Dee, about, so why does this bridging important to folks like us? Like Mike, we're not a traditional funder, although in fact I had to think about, are we really a funder? And we are, because we do provide seed funding often to teams as part of the work that we do. And the bridge really is based on, one of our values is to act with integrity. So we need strong evidence to both inform the ways that we work and the ways that we evolve those ways of working, and also evidence related to the solutions that we're looking at, the approaches that we're taking, to make sure they're really grounded in a good understanding of what works well in what context as we move forward.
Apologies. The Zoom clicker button was not quite as fast as I wanted it to be. Thank you. Those were excellent comments. So I do have another question for you. So money matters, but it's not just about money. What other strategic supports might you look for to help advance systems change?
Yeah, I do think in this type of conversation that's super important, right? Because sometimes the barrier is money. And maybe like you, Melina, we often hear from teams that we support that some of the value in the money we're able to bring is its flexibility, to be able to apply it in different ways than you might be able to with a traditional stream. But often, if we look into what we know from implementation science about what actually helps achieve large-scale change, there's other benefits potentially as well that you can look for. So, do you have access to the tools, supports, and resources that will help you to move forward? What about coaching? What about connections with other people like you who are trying to make similar changes happen across the country? Or what also about the networks and relationships you might need? So, for instance, we did a lot of work a couple of years ago with paramedics who were looking to provide palliative care in the community. And that required changes in federal regulations, in provincial rules around scope of practice, and in municipal requirements as well. So as you're looking for who are the right partners for you in the work that you do, what are the things that each of you is bringing to the table? And, in some cases, that may mean even a multi-partnership. So a few years ago, for instance, we partnered with CIHR, Health Research BC, and others to look at the things that we could bring to about 1,500 long-term care homes across the country who are interested in how do they implement promising practices in the context of the pandemic, but also bring in the best knowledge around implementation science, and how can that help to move things forward as well? So research and action at the same time.
Of the panelists, this has been an amazing start, and I know we do have some questions from the audience. And before we do that, maybe I'll offer just briefly, I know I'm the moderator, but from the perspective of somebody who navigates multiple health systems, interior health, within my roles within the Rural Coordination Center and the Canadian Health Leadership Network, I want to point and underline at something that I think was drawn out from all five of you, and that is the importance of partnership. And not just partnership as in, hey, come on, join, I've got this great idea, but that relationship building, the piece where you develop the relationship and you really get to know what's important. Where is the win-win for everybody? How do I navigate something that in a health system that's constantly changing? Well, one of the key ways is to have those relationships. And as funders, or as somebody who has a team or multiple roles in connecting the dots, I'll say, things change all the time. And so when you have those relationships, you can pick up the phone, send a text in our day, and just check in and really sort of listen. It's amazing how much faster things work and how the impact of whatever activity is being funded has a greater chance of actually being useful within the system that can change and transform the system, which is why I think this bridging concept of the entire 2 days is so incredibly important. So I think you all pointed at that, and from my perspective, I think that is really hugely important. So thank you. And now let's move to some of the questions that we're getting from the audience. So one of the top questions is that it's hard to keep track of funding opportunities in this space. Are there any known channels to keep in the loop, or do we need a central coordinating function? That is a great question. Not sure who wants to take that. Maybe Danielle, do you mind if I sort of get your thoughts on this, and then maybe I'll go just let you answer that and just see who else on the panel would be curious about offering some feedback.
Yeah, I think centralized funding opportunities if as a need certainly could be one. I think for us, it's the usual channels. If you know the organization, the funding opportunities are typically listed. UBC has a great newsletter. Those typically highlight what new funding opportunities exist. So I think figuring out where your suite of research is and what communication networks you have where you can see what those funding opportunities might be. But I think it is a good point, especially at the provincial level, what new funding opportunities come about and where the best places to synthesize this information. But start with your organization and figure out what newsletters exist to find that information. And then certainly if you have key funding agencies that you're looking at, staying in touch with them through social media, through their websites is also a great place to just keep in the loop for what their consistent funding opportunities are or what new funding opportunities might arise. But the foundations may have a different perspective on that as well.
Yeah, great answer. And anybody from the foundation perspective want to take a stab at that question? And Jennifer, I'll come to you from a Health Excellence Canada perspective as well.
I can add one thing quickly. So there's a portal called Grant Connect where a lot of community foundations and other funders will post their grant streams. Sometimes you need to have an account and a password, but I do believe all major library centers, so whether that's the downtown library in Kelowna or downtown in Vancouver, they should have a free version of that. So I believe you can go and speak to the librarian if you don't have a paid account for Grant Connect. But as Danielle alluded to, organizations like ours, we might not have our funding cycles posted on Grant Connect all the time because we're continuous. So we take grant applications throughout the year, not always just at specific intervals. So it's really important for you to get to know your funders, your community agencies, and which strategic priorities you might align best with, and reach out and get to know them.
Wonderful. Angela?
Yeah, I might just add that I would think Vancouver Coastal Health Research Institute also consolidates that information for researchers across the system. So that's one source. Another would be really for us, if you were interested in partnering with us, is just, you can look at our website and see the kinds of things that we've been funding. Is there a fit there? Is there a theme there that you fit into? But other than that, I think the resources that others have indicated are a good start.
Wonderful. Mike will maybe just hold a spot, and anything else to add to that?
No, I was going to suggest Grant Connect as well. I do know that the Vancouver Public Library has access to it locally. I don't think you can get it remote, so you might have to go in. That could have changed though over the last year or so. And then individual funders' websites will often have a sign up for grant alerts, and so you'll get emails when new things come up. But it is really challenging with the pace of change and new grants coming online and other grants shifting or winding down. It's a constant sort of cat and mouse game, I think.
Indeed, it is. Jennifer, do you want to take your perspective on this question?
So first of all, I think those are all great suggestions, and I've just learned about some new ones from my perspective and made a mental note of some places that we need to make sure that the opportunities we have get into, so they're part of the circulation. I do think, larger institutions do tend to have good consolidation and good offices. I guess for me, though, it also comes back to thinking really about what do you want to do, and therefore, what is the best kind of fit and opportunity for you? Because it can seem overwhelming if you're trying to monitor absolutely everything going on. But if you really thoughtfully thought about, here's what I actually need, then that helps me when I'm doing this to narrow in to who am I actually going to monitor for what's coming up, because they're my best fit and partner for what I want to do.
Point. So it's that sense of what is the question, and matching that again. So thank you, everybody. We're going to take another question. So the question from Slido is really around how do world events and all of the funding cuts that we're seeing south of the border, and some of the things worldwide, how does that affect research funding in Canada? And maybe I'll start with just an overarching comment on this. I'm an optimist, and I see there's really new opportunities within Canada to work across different groups and organizations in a way that's new, in a way that's inspiring, and in a way that's really, truly exciting. And so while I don't want to diminish the events in terms of the impact and the sort of the uncertainty that is being created from these events, I do think what I'm seeing in my day-to-day in different hats is that people are having different conversations again, similar to the pandemic, where there are new ways of thinking, new ways of working together. And so as an optimist, I'm taking that overarching stance, but curious, I'm just going to let whoever feels like they want to volunteer their perspective on this. Go ahead, Jennifer.
So I might actually switch hats slightly to one that I didn't introduce myself with, which is I'm the president-elect of the Canadian Association of Health Services and Policy Research. And so we've been hearing absolutely from members across the country about how changes globally are affecting their research, whether that's access to data, whether that's funding, whether that's resources and tools that people have come to depend on. But to your point, Dee, we're also hearing about opportunities and new avenues that people are exploring and seeing. So it's definitely one of those interesting times, in the phrase of that old proverb, in terms of the situations that we're in. We are having a conversation shortly about those kinds of impacts coming up at the conference. And we're planning on feeding that into the policy process. So if anyone here has thoughts, impacts, things that they think should get into that conversation, maybe an opportunity to connect separately and make sure that we're hearing broadly from folks.
Wonderful comments, and I like to use sort of quotes here and there, and I'm not going to get this quote correctly, but it's, I believe, a Bob Dylan poem or song that says, the cracks let the light come in to dark places. So keeping that optimism, but at the same time, over to you, Danielle. I think you had signaled that you might want to check in on this question too.
Yeah, I just want to echo, I think your start with optimism is an important one, because it does offer the opportunity to work differently. And I think as funders, it's an opportunity for us to work differently, to partner in new and different ways too. So I think that's something that's top of mind for us. I do think there's a reality too, that in the funding environment, especially when there are new pressures, it'll put new pressures on us as provincial or regional organizations for more people seeking funding where other funding sources haven't been available. So I think that is part of the reality. But how we see that as opportunity for stronger collaboration, stronger partnerships is important. And for people who are seeking funding, it means that you might be looking for working more closely with the foundation, and that's not something you've done before. So it's an opportunity to build new relationships and understand how new funding mechanisms might work. So just a couple of thoughts to add, Dee.
Wonderful. Thank you. Really appreciate the question. It is certainly top of everybody's mind. And I think what I'll do is switch to another question we've got that's really aimed at the foundations. So question is, sometimes it feels like hospital foundations compete for the same dollars from the same group of philanthropists. How can we collaborate instead of compete? And again, I'll maybe offer a couple of my bridging comments just while the folks from the foundation sort of get their head around this question. I really have seen a shift in multiple, I've worked with multiple foundations, and to Melina's point earlier around how even foundations are approaching sort of a win-win, right? And so I have seen, number one, hospital foundations really coming together on this issue, and also the thinking around what foundations fund is definitely changed, certainly in the last 2 or 3 years from the experience that I've had working with different foundations. But again, you can hear my optimism and in there, and I do understand this is something that is a question on people's minds. So from the foundation group, anybody feel like you want to comment about or answer this question around compete versus collaborate? Angela, go ahead.
Yeah, I'd be happy to. We've had over the last 5-6 years, and longer than that, of course, but really in the last 5-6 years, it's accelerated those kind of partnerships. So we've negotiated really quite substantial transformative gifts with UBC Faculty of Medicine, with BC Cancer, with BC Children's, so on very different things: epilepsy, MS, pancreatic cancer. So it's been really exciting because I think it's that acknowledgement that there are areas of mutual benefit and overlap that we have, and working together is going to be better than competing. And I think donors have really, really appreciated that. So I do think there's enormous opportunities, and we've in this space of innovation, kind of again recognizing some of those gaps that we see, are trying to kind of bring some of the hospital foundations across BC together with Michael Smith Foundation, with Life Sciences BC, and say, how could we look at this differently? It's always challenging when you're working with multiple organizations. We all have our kind of day job and our focus, so it's always difficult to get sort of new things off the ground. But I think there is. I agree with you, Dee. I think that it's the environment has changed over the last decade, and I don't know if COVID sort of accelerated something that was already starting, but I see that as well, and I just see there's enormous opportunity. Donors find it so refreshing when they know we're working together.
Answer. Just curious, Mike or Melina, any additional thoughts? Yes, go ahead, Melina.
Sure. So as we all know, donors love, whether it's matching funding or opportunities to double their impact. So we love collaborating. We don't want to use the word competition. We often do collaborate with other foundations within the Interior Health region for regional projects. But we've also worked with UBC Okanagan on other partnerships. We're working with them right now, the Southern Medical Program, to identify projects that grad students can get involved in and support physician leaders, because they don't always have time to be the principal investigator on a project, but we know and they know that there is work to be done in that space. So what we've done is identify the areas of care that are kind of priority for some of our donors, where we know we have the funding support, and we're just waiting to kind of get that project roster back of what we can do. So absolutely, we love to collaborate. It would be amazing if we collaborated with other foundations and funders on this call even. So it really comes down to the project and where there's a fit. So if that's an opportunity for us to collaborate with UBC because it's more academic in nature, or is this a Michael Smith research opportunity? So please just reach out, and behind the scenes, the funders can have chats and discuss what eligibility fits with each criteria and how we could support it collaboratively.
Wonderful. Thank you so much, Melina. So I'm going to move to the next question and actually take this. There's a question around how there seems to be a gap in having health authority leaders involved in research as partners to co-create knowledge. Are there opportunities to address this? And my big answer to that is yes. Yes. It is. I know it's difficult. I know sometimes, as I said, the health authority can feel like a daunting thing to sort of navigate through. I want to put a shout out to all of the health leaders, not just within Interior Health, but within the province and Canadian-wide, doing some incredibly important, impactful work. And so sometimes, if there's a project that comes up, one of the just basic, again, I'll come back to building those relationships, having them understand in really plain terms what the project is going to address that might connect to a priority that they're dealing with, and some patience, right? Because the system is doing a lot of work, and those health leaders are really they're dedicated, amazing people. I feel privileged to be able to work with them in my day-to-day within Interior Health. So that would be sort of my comment. But I will say, from a more formal point of view, within British Columbia, all of the health authorities have research departments. That is your first stop. They will help navigate. We've got a provincial initiative strategy for patient-oriented research. A lot of people call it SPORE, and there's a hub. They also have connections depending on what you're doing. And then, of course, if you haven't heard, something called RAP, the research approvals, PP. I can never remember the PP part, but bottom line is that this is the Ministry of Health's work with all of the health authorities and academics and partners and patients that has been going on for a couple of years now, that really is looking at harmonizing and making it easier to get into the system and support the important work that the question really aims at, I think, underpins, which is how can we partner if we can't get access and they don't have time? A real honest question. So that's how those would be some of my bits of advice. And Danielle, I'm going to let you take that question as well.
Yeah, and Dee, you and I talk a lot about the culture of research, especially in the health system and health for healthcare transformation. I think the other thing, I had a conversation, this has been some months ago, with a researcher that was in a health authority setting and said, well, you know, there's all these other things going on. Research isn't a priority. And I think part of making sure you have good engagement with health authority leaders is understanding what keeps them up at night. And where is research actually a solution, even either evidence that exists or evidence that needs to be generated that's really specific to those problems. So I think the partnership opportunity is absolutely there because we want evidence-based approaches to healthcare delivery and transformation, but it's really developing those relationships, which has certainly been a common theme, to understand where can research help. And so I think if you can lead with that and build relationships around that, that also helps with that co-creation. So just wanted to add that, Dee.
Beautiful. And actually, Danielle, since you're up, I'm actually going to ask you to take this next question, which is for researchers securing new funding. It often depends on past funding. What are your thoughts on supporting this kind of early career researchers without a track record? And I think this is an incredibly important question for our province and for this bridging activity. So Danielle, any thoughts from you? And then I'll look to see if any of the other panelists want to dig in on this question.
Yeah, I have two thoughts to kick off, and I'd love to hear from others. So yes, I think track records can't just be about prior funding, especially if you're early in your career. This is where what I mentioned before in terms of us learning alongside other funders, what are different ways that we can advance research where you're not tethered to that traditional belief that you have to have funding in order to get the next bit of funding. So how do we build the evidence around innovative ways to funding to make sure that we're equitable in how funding is released? The second part of that goes back to being able to articulate in your research applications, what's the problem, what are the relationships? And I think this is where that engaged component makes a big difference, because if you have different people, different perspectives on your teams, patients, health authority leaders, policymakers, who are saying, yes, this is an important problem, this is how we're going to be part of that research process, then you start to get to, this is research that's going to actually solve problems or be implemented into practice. So I think it becomes not just about what we can change as funders, but also making sure that you're embedding that in the proposals that you're writing. So those are just a couple of thoughts, but would welcome the foundations or Jennifer to weigh in on this as well.
Yeah, I don't know if anybody else wants to speak to that. I think you answered that really, really well. I think what I'll do is underscore what Mike was saying in his introduction terms around participatory action and community, and bringing them in, and the foundations. I mean, they also help. They've also helped really, I think, support sort of some of these projects that may not have been funded through traditional research, tri-council kinds of funding. So noting the time, it is 9:52. Really appreciate all of the questions from the audience. And I saw one about collaboration. I think that our contact information is out there, and just looking for permission from each of my panelists to, if there's a question out there in the audience and they want to contact you, it's okay just to email, and that's okay. Got a thumbs up around. Awesome. Okay. So I want to just have each of you comment on, in our last sort of 7 minutes, What advice, and I think you've given excellent practical advice, and this is around that bridging. We've had, I think, a really good conversation that's dug into some of the issues with some practical things to consider. But we'll go in reverse order this time. Jennifer, if you're going to give somebody some quick advice in kind of a minute around this topic of bridging, what advice would you leave with people?
I think I'd go back to where I actually started earlier. So start with the end in mind. Think about what you're trying to achieve, and then who do you need to work with, and what are the things that you need around you to be successful in getting there?
Perfect. All right. Back into, so Melina, next.
Great. I would say include as much detail as possible. So if your project is going to reduce a wait list by 25%, we need to know that. If it's going to reduce hospital admissions from 4 days to 1.5 days, we need to know that. That ROI is really important. We often share the information from a grant application with our donors to obtain support because we are an active fundraising organization. So that's really important that you give us as much detail as possible, and please don't force the fit. If the strategic priorities don't align, there's likely another organization that it will align with. And maybe we can help be that liaison to find that other organization or agency. But just because there's a call out for funding doesn't mean you should apply if you don't actually align with those goals.
What great advice. Mike, over to you.
Yeah, that's fantastic advice. I do think there's there's a variety of funder personalities, if you will, and so you can find a funder that's aligned with the work and the process that you want to do. So even around that question around early career researchers, I think for our funding at Vancouver Foundation, we're more risk tolerant than others in terms of the things that we'll fund. If it's a good idea, we're willing to take a chance. And there's also opportunities to sort of ladder into larger funding as well. So we've got a smaller grant that gets project teams ready to apply for a larger grant. And if you're successful with that smaller grant, then there's a good, the hope there is that you'll be set up for shopping that project around to other funders and back to Vancouver Foundation as well. Other things for us is that, that community buy-in and participation in all aspects of the work is what we're ultimately looking for when we're looking at these types of applications. It really demonstrates to our decision makers that the work is meaningful to those most affected. And then it helps as well. It helps reviewers see what might change because of the research is really important too. So thinking about that system receptiveness piece, how the material conditions might change for community as a result of this research, those kinds of things are really inspiring to folks that are trying to decide between competitive and really good applications that are coming forward.
Wonderful.
And yeah, I think that's about it. That's good.
Thanks, Mike. So engagement and impact. Wonderful. Angela.
Yeah, back to what Jennifer said, like who you're working with. So in our case, a lot of things that are in the healthcare system, you need to have certain kinds of approvals, obviously, to move ahead. But what other sort of capabilities are you going to need in that mix to be successful? And then the way that we often pitch things to a donor, I would say, is a good way to think about it. So that's one, what is the problem you're trying to solve, including the kind of metrics, as Melina talked about, of, so if it is wait times, what is it going to do? How are you going to know that you're successful in that? So what's the problem you're trying to solve? Why are you particular? So it's the second question. Why are you particularly suited to solve that problem? What are your attributes? And that can be the mix of people that you bring together. What are those attributes and why does that make it uniquely? And then what's it going to take? So that's the probably the easier part that most people have already thought of is how much money are they going to need, et cetera. But what's it going to take to be successful?
Wonderful. Danielle.
I agree with everything that's been said. And when I was thinking about this question, I was actually thinking about it from applying for funding. So before joining Health Research BC, I was a research faculty, and grant writing was very much part of my life. And the thing that I kept thinking of is mentorship. And this is for students in the room, for early career researchers, but also researchers who are thinking about pivoting to other funding agencies. So how do you reach out to your colleagues and mentors and understand how do you connect with different funders, new funders, whatever the case may be? So to the extent that you can connect with mentors, connect with resources that are within the universities to understand different funding opportunities, et cetera. In addition to what's already been said, I think mentorship is always key.
Absolutely wonderful. Well, that brings us to the, we've got 2 minutes to spare. I want to thank each and every one of you, my fellow panelists, for joining this incredible panel. I think there were some really concrete, practical things that hopefully the audience took away. I want to thank you, UBC and UBC Okanagan, just for hosting what I think is an incredibly important event that I hope we see on an annual basis. Marie in the room, really appreciate your opening remarks and getting us started. I hope all of you have a wonderful rest of your day. And to the audience out there, there is the next event starting here within 1 minute. And there is a link in the chat for those of us online that want to join the next plenary session. So thank you. Wonderful day. Have a wonderful weekend, everybody. And looking forward to the next conversation. Take care.